Hi. Hi, everybody. We're going to give everyone a few minutes to start. So it'll start saying people are watching there.
Okay.
So we're going to go ahead and start. Welcome everybody to the Loudoun Moms Ask the Expert. I am Laura Griffin. I'm one of your admins. I'm also a mother of two and a real estate agent in Loudoun County. And I'm here with Mary. I'm going to call her Mary Frances because that's what Leah does. And she is with Teach Speech here in Loudoun County, and we're actually in Broadlands today. And she is going to answer some of your questions that you guys have posted and also kind of go over a little bit about what she does in her business. So I'm going to let you take it away.
Okay. Well, my name is Mary Frances Gonzalez, and I am a speech pathologist and the owner of Teach Speech, and also most recently the Thumb Sucking Institute here. We are in Broadlands. And I also am a mother of two boys, and they are in elementary school and middle school here in Loudoun County.
So tell me a little bit about what is Teach Speech.
Okay, so Teach Speech is a pediatric private practice, and we work with children from toddlers to 12-year-olds, okay. And we work with speech, language, or oral myofunctional disorders.
What is that?
So oral myofunctional disorders are disorders that have caused, it's kind of difficult to explain.
Okay.
But what it does is it helps sometimes in development, whether it's feeding or child development in general. We have some patterns of behavior that had to be modified for whatever reason it is, like our thumb suckers, our pacifier kids, our sippy cup kids, or enlarged tonsils and adenoids. And so things grew and developed around those things, and they created these patterns called maladaptive behavior patterns that we want to fix for proper growth and development of our mouth.
Okay. And then I know you just started the Thumb Sucking Institute. So tell us a little bit about, I am a reformed thumb sucker. So tell me a little bit about what that is, because I know you just started it. It sounds exciting.
Okay. So the Thumb Sucking Institute was created to help children eliminate finger or thumb sucking habits. Okay. As a former thumb sucker myself, I know that prolonged thumb sucker, we should say, that I know that the damage that thumb sucking can do to the development of your palate in your mouth, and I want to help families and their children eliminate that so they don't have to go through a couple sets of braces like I did myself. And
I have them too. Yeah. I have a permanent one still glued in my teeth. Yeah.
I mean, there's always genetics, but we try to, create the scenario for the best growth and development, but genetics are always part of everything. We also do pacifier elimination.
Oh, I could have used that a couple months ago. That was a challenge. Yep.
Yeah. We do messy eating, and then we also do the oral myofunctional therapy as well, because a lot of those children that are doing these habits usually creates, the patterns to go to the oral myofunctional disorder.
Okay.
So it's really exciting, and I'm really excited for it.
And we're actually here at her beautiful office. So that's what you're seeing behind us, is she's got a really cool, fun office with all sorts of goodies. So
thanks.
And puppets and everything. So
thank you.
So tell me a little bit about, do you want to go through, we had a couple questions. Do you want to go through those, or do you want to talk a little bit about some of the common questions that we had?
We had a couple questions, so we probably should answer them.
Sure.
The first one was
from Jessica.
Okay, I do.
It says, my two-year-old demonstrates a forward thumb thrust with many sounds. At what point is this still developmentally appropriate, and when is it a concern?
Okay. So all children are born with a tongue thrust reflex.
Okay.
And as we grow and develop and start chewing and swallowing and eating, we start to reduce that natural reflex that starts about 6 months, but can kind of mature until 12 to 18 months.
Okay.
So when we start to switch from bottle or breastfeeding to foods, we start to move, mature those skills in the tongue and the jaws, and the tongue will move back, and you won't see this forward thrust, right?
Okay.
So we kind of say at 12 to 18 months, we're looking at that, and it should be inside the mouth. So we want to encourage that, because where the tongue is for feeding is where it goes for sounds.
Okay.
So at 2, I guess I would ask, why is our tongue still forward? Is there something that's causing that, or is it just a habit? And kind of see if you need to take a look at that. It isn't uncommon for kids to still lisp at that age, but you definitely want to take a look at, do we have big tonsils and adenoids? Yeah. Are we using a pacifier still or sucking? Because those things will encourage the development of that forward tongue thrust to continue.
Okay.
So you kind of have to look at a couple different things and see, is there something causing it, or is it just a matter of we need to remind them to pull that tongue in?
Okay. And then let's see, Alice had a question. My 2-year-old has been diagnosed with a motor oral issue. The speech pathologist is not 100% sure of the severity. We just started last week. Just wondering if this really means and what kind of things can I do at home to help. If he drops the middle and ends of words, stops chewing while eating, chews straws, doesn't like brushing his teeth, he's developmentally delayed and only has about 50 to 60 words and no 2 to 3 word phrases. So I guess what it really means.
Yeah, I responded to that, and that it was kind of a little bit of a specialized case. And she's working with a speech pathologist, so that speech pathologist will be able to actually give her really specialized strategies.
Okay.
However, I can give some general strategies on how to encourage, proper oral facial development. The first is, if you can, breastfeed if you can.
Okay.
If not, of course, there's nothing wrong with that. There's also bottle feeding as well. We do want to get off that bottle at a year and also eliminate that pacifier beginning at 6 months. So breast is best, bottle feeding, use the pacifier as needed and then start to wean that at 6 months, try to get that out by a year. And then, start introducing them to solid foods. Don't stay in that pureed too long. I personally did that as a mother because I was fear of choking on everything. Mm-hmm. But you want to move forward when they're ready to start getting them to chew and manipulate the food with their jaws, because a strong jaw is going to lead to strong development overall.
I didn't know that.
In the feeding and speech sounds too. So, start getting them to chew a lot of things, and then don't prolong the sippy. Don't use the sippy cup. Don't prolong those other things that also can encourage sippy cup, sippy straw, pacifier. Those need to be all gone. And so when you take those away, the child starts using things that they're supposed to be doing with their mouth, and it grows to where it needs to grow.
Okay. The next question came from Sarah. I saw a language milestone chart posted earlier. Do you have a quick reference or typical development for individual needs? At what point should I be concerned? I know we see this question a lot. My child's at 12 months, 18, 24. How many words should they be having, or sentences and things like that? I know is something we get asked a lot in the moms groups.
Okay, so there's a lot of language developmental milestones all over the internet. So it's really, really hard. You can go to my national organization for speech pathologists, asha.org. They usually have a really good one there. I personally, and I can post a PDF of it, I like to use the Iowa-Nebraska articulation norms.
Okay.
And I think that gives you kind of an idea for your speech sounds. Now, your language milestones you'll find best at the asha.org, but it's confusing because there's a range for a lot of these different milestone charts. So if you suspect, I would definitely reach out to somebody who can help you, like a local speech pathologist, even just to speak to them, to ask them some questions. But asha.org is our organization, and they have all of those norms posted that parents can look at.
And what we'll do is at the bottom of this video, the live video, when I save it, I'll have Mary Frances post it for us. So we'll have that. Because I know it is one of those things as parents, at 12 months, your child's only having so many words. I know it's one of those biggest concerns that we all have. And
and it's kind of a big picture kind of thing. Yeah. So you're looking at not just the words they're using, the sounds they're using, how they're using them. So it's kind of a big picture. It's a little difficult to always answer that.
Yeah. And then is it normal for, this is from Ashley, is it normal for a 2-year-old to stutter at times?
Okay. So during toddlerhood and preschool years, it is not uncommon for children to stutter because the brain is moving a little bit quicker than the motor movements of the mouth. However, with that being said, we also want to keep an eye on those kids who maybe have a family history of stuttering, or if you're seeing some secondary behaviors like they're, blinking or groping for the words, you see other actions in addition to the stuttering. I would kind of reach out to somebody to kind of look to see to a professional. generally, yes is the answer. It is not uncommon, but you want to know if the dad or grandparent or there's a significant family history. You definitely want to keep an eye on that. And also, if it gets worse, how long has it happened? When does it happen? Are they frustrated or when they're excited? If they're just happy and it's happening, that's also something to consider too. So again, it falls within the average range of that child's age, but you do want to look to see if there's other issues behind that.
Okay. And that was the last
bilingual one.
I don't think I saw that one. Do you remember what the bilingual one was?
It was a general one about bilingual. Is it common for bilingual children to be delayed? Okay. So children can learn language pretty easily. Some children have difficulties with it. Other children do. Most children do not. It is not uncommon for a bilingual language learning child to have a little bit delay in what they say, their expressive language.
Okay.
When they're learning dual languages, because they're trying to figure out, like, this word means this in English, or this word means this in that language. So it's not uncommon, and what the research says is that it can delay. Bilingual language learning homes can delay the expressive language by 6 months.
Oh, wow. Okay.
But they also should be understanding both languages 100%. If they're not understanding one of those two languages, I would definitely investigate, but it is not uncommon. And my own son did that. Mm-hmm. My first son, we raised in a bilingual household. And it took him a while to kind of figure out which one to use with which person, mm-hmm. but he definitely followed directions and understood vocabulary in both languages. And eventually, once that click happened, we caught up really quick.
Yeah. Tell me a little bit about, so you just started the Thumb Sucking Institute. Mm-hmm. So that's just for kids that are still sucking their thumb or using a pacifier.
Okay.
Kind of.
There's a couple little programs.
Okay. Tell me a little bit about that.
All right. So the Thumb Sucking Institute, we have a couple different programs for thumb sucking. We don't worry about thumb sucking until they're about the age of 5 and their teeth have started to fall out and they're starting to get their permanent teeth, because that's really when we want to make sure it's out of there.
Okay.
So our original program is for 5 and above.
Okay.
But we also have another program for 3 and 4-year-olds. It's not direct, but it's another program in which we encourage reduction of that thumb sucking in hopes that you don't have to come back here at 5. Yeah. And so we take a look at that, because sometimes when we thumb suck, it's not just to have it. Sometimes there's a reason behind it. And so we look at that big picture. And then the Pacifier Association. Well, a lot of these thumb suckers don't have pacifiers because they got rid of the pacifier and they're doing the thumb. And
because it's easier to have. It never falls out. It never goes anywhere. The thumb is always there. So.
Yeah, the thumb is always there. That's a tricky one. So the Pacifier Association is for children that it's prolonged and the parents are having a really difficult time because it's in their mouth all the time. Because we definitely want to get that out, not only for development, but you can't speak if the plug is in your mouth, right?
So what age? I know, like Braden both kids are about 2 years old, and then we gave it to a store to buy a toy, and they were okay with us giving it away to buy a toy, and it was fine. But at what age? We went till 2. I'm gonna admit. What age should we kind of be starting to wean and or get rid of that pacifier, ideally?
Well, it's changed a bit too, because my children also. We threw away their pacifiers at 2, so it's changed quite a bit. I believe in pacifiers. I believe in the research behind using a pacifier, especially for SIDS and your infants. But here's the thing, they need to be used appropriately and to soothe, right? Not to just plug them up. Mm-hmm. So about 6 months, you want to start reducing it. Okay. Naps in nighttime. Mm-hmm. Don't put it back in if it falls out.
Yes.
And then by 1, you really want to eliminate it. That's what is suggested. As a oral myofunctional therapist, as well as the pediatricians.
Okay.
So this program would probably benefit those parents who are not really sure how to do that.
Yeah.
After the age.
So we're getting into 2, 3, 4s, and we still have it. We should probably look to seek some help.
Yeah, I would say definitely after 3. You definitely 3 and later. You really, really probably need a little bit of help.
Yeah. Well, it's like a habit. It's just like anything else. It's
hard.
It's a hard one to break.
It's even harder to throw it away for a kid. It was hard. If it wasn't for my husband, I'd probably still have them. But he helped me.
It's so, yeah, sometimes it takes both of us, because I know, yeah, my husband and I was like, oh, just let him know. And yeah, we kind of went back and forth and things like that. Are there anything else parents should know about with your, anything else, any other tips you can give us? Or
Let's see, did anybody write anything?
anybody? Let me see real quick. See if anybody wrote anything.
Okay. A couple little tips that I want to talk about that I think I know as a parent I didn't know a lot about this stuff, even as a speech pathologist.
No, Alexa, she just said hi.
Okay.
It was the only comment.
I definitely want to see, what I'm seeing a lot in
Mhm.
not only my speech kids, but also my myofunctional kids is some issues with airways. Let me tell you, if your child at any age is snoring, I highly recommend speaking to your ENT, because snoring is not normal in children. There's a reason for it.
Mhm.
So that is one thing that I'm finding, that we're getting these kids that come in and there's a reason for their snoring, and they end up with sleep apnea, and then you have a couple years of a kid
Yeah, my
without
daughter.
getting the appropriate sleep
Mhm.
and oxygen to the brain. So
Mhm.
if your child snores in any way, call up your ENT and make an appointment, because that is not normal.
Yes.
Ever.
Yeah.
So that's a big thing. And number two is, as soon as you can, start teaching your child, your drooler, even at 18 months, to start keeping those lips closed. We want all our children to be good nasal breathers.
Yes.
Okay, because nasal breathing and your mouth closed is really going to help that development of that face and those sounds.
Okay.
So I definitely see that I'm seeing a lot of those things that my families are like, oh, I didn't know about that, and I didn't either when I was a mom.
Nope.
Young mom, but now I do. So
Yeah.
I want to share it.
We have snorers in our family. We're just now getting that taken care of for both of ours. So
But your daughter was, right?
she does not have sleep apnea. She doesn't go into REM sleep.
No.
She's a non-REM sleeper, but she still snores, and the adenoids are out. So next is the tonsils, probably. So
Yeah.
yeah.
Take it conservative. Yeah.
Yes. Yes. So yes, and then the baby snores too a little bit.
You got enough of the concussion.
I blame my husband.
The concussion to get going.
I'm just gonna blame my husband. I don't snore.
Yeah. So I just think if you ever have a question, speech pathologists are always more than willing to help.
Mm-hmm.
Give somebody a call. You can ask a question, or even just set up a consultation, because Googling is really difficult.
WebMD. I help with
WebMD.
WebMD everything.
I definitely do that too. But I think that in my field, there's so many different ways that things are stated and explained, that it's really difficult for a parent to be able to say, I need a clear-cut answer. It's not always there in our field, but specialists can give you ideas and recommendations.
Yeah, because you gave me some recommendations with Madison, like Miss Mary Mac, that song.
The rhyming.
Yeah, the rhyming songs to kind of help her and
Before
my son.
kindergarten.
Yes, before kindergarten, the rhyming. We still sing them in the car all the time. So I think there's definitely little tips and tricks you can do, and finding an expert like Mary can help you with that. And it looks like you don't have any other questions.
Okay.
Other than everyone saying hi.
Right.
Is there anything else you wanted to? If anybody has any questions, feel free. I'm going to link her business page on there. You can message her if you've got some more specific questions, because I know sometimes, there's a little bit more detail that she'll need to follow up with you on for that. But is there anything else you wanted to share with us?
No, thanks for listening.
Yeah, thank you for having us. I love your office. I want to come work here. It's so much fun. So I hope everyone has a great Tuesday, and we will talk to you soon. Bye.
Bye. Bye.